We will now demonstrate the use of the CAD Prism pump. The nurse will wash and dry her hands with a paper towel and assemble supplies on a clean, dry surface. The supplies include the medication bag, alcohol swabs, tape, a 9-volt battery, saline flushes, and heparin flushes if applicable. Check the medication label on the bag to confirm that it has the correct patient name, medication, and expiration date. The medication bag has primed tubing pre-attached by the pharmacy. The nurse will now insert a new 9-volt battery into the right side of the pump. The pump will beep, letting you know that the battery is in the correct position in the chamber. It is extremely important to allow the pump to go through its power-up sequence prior to attaching the pump tubing. This process takes approximately 30 seconds, and the pump will beep 6 times when the power-up sequence is completed. As the pump goes through its power-up sequence, this is a good time to check the pump settings in relationship to the label on the medication bag. Next, attach the tubing to the bottom of the pump. You first must remove the blue protective device on the cassette. You will notice that there are 2 hinges on the cassette and 2 hinge pins on the bottom of the pump. These must be lined up to allow proper installation of the tubing. Hold the pump upright on a flat surface such as a tabletop, and pressing down on the top of the pump, use a coin to tighten the screw on the right side of the pump to lock it. The slit must be in the up and down position at 12 o'clock and 6 o'clock to assure that the cassette is properly locked. The pump will also display an alarm that the administration set is latched. Press the next key as instructed. The screen will now ask, reset the reservoir volume to blank mil. Press the Y key to reset the reservoir volume to the previous setting. If this is the first time you are using the pump, this question will not appear as the reservoir volume is already programmed to the full amount. The screen will now ask, prime tubing. Press the N key or the down arrow as the tubing was pre-primed in the pharmacy. The next question that shows is start the pump. At this point in time, we will prepare the injection cap to attach the pump tubing. Cleanse the needleless injection cap on the IV catheter with 3 alcohol swabs, wiping for 1 full minute. Remove the cap from the saline flush and attach the flush to the needleless injection cap. Insert the contents of the flush using the push-pause technique, stopping at the last 1/2 cc of flush solution. Disconnect the flush and discard. Remove the end cap from the pump tubing and screw the tubing onto the needleless cap. Open all clamps. At this point in time, if enough time has passed while you're cleansing the cap, you may need to press the start-stop key to get the question start the pump. Once the question appears on the screen, you will press the Y or the up arrow to start the infusion. The pump will go through its settings, which is a good time for you to double check them. And when the infusion starts, you will see a green light at the top of the pump start to flash. There are two small circles at the top of the pump. The green light is on the right, the yellow light is on the left. A green light flashing signifies that the infusion is going in without problems. If a yellow light only flashes, that means there is an alarm condition that needs to be attended to. Sometimes you will notice during the infusion that you might have both lights flashing, and this indicates that a battery might be getting low or that the pump is getting close to the end of the infusion. As long as there is a green light flashing on the right-hand side, you still have fluid that's being administered. We will now demonstrate one common alarm condition that you might experience. This is the high pressure alarm. It is a two-tone alarm that you hear now, and it occurs when a clamp is left in place or if the IV access device is not patent. You simply locate the source of the occlusion. If it is a clamp, loosen the clamp, and that should actually stop the alarm from occurring. To stop the infusion, press the Start/Stop key. The pump screen will ask, "Stop the pump." Press the Y key to stop the infusion. Disconnect the tubing from the pump using a coin or a key to loosen the screw on the right side of the pump. Unscrew the pump tubing from the needleless injection cap. Cleanse the needleless injection cap with 3 alcohol swabs, wiping for 1 full minute. Remove the cap from a saline flush and attach to the needleless injection cap. Insert the contents by using a push-pause technique, stopping at the last half cc of flush solution. If it is an open-end catheter, repeat with the heparin flush, stopping at the last half ml of solution of the 3 ml syringe. Remove the 9-volt battery from the pump and discard. This battery is not to be used again for another infusion. When placing the IV medication bag into the carrying case, it is important to be sure that the Velcro tabs are secured through the opening at the top of the medication bag and across the spike port at the bottom. This keeps the medication bag from sinking into the bottom of the carrying case. By placing the Velcro tab across the spike port at the bottom of the bag, this prevents the spike port from flipping up and causing an upstream occlusion. The 2 large Velcro tabs are inserted across the main body of the medication bag. The pump is then placed into the pocket face down so that the face of the pump may be observed once the case is closed. This concludes the demonstration of the ambulatory pump.